Hello, welcome to the Inside Look. My name is Neil Arwin Mercado, reporter for INQUIRER.net. Joining us here today is Tourism Secretary Bernadette Romulo-Puyat. Ma'am, good afternoon. How are you?
Hi, good afternoon, Neil, and good afternoon to everybody watching you. The
Yes.
last time you interviewed me we were also under ECQ.
Yes.
Yeah,
that,
so
that
it's
was a year ago, I think,
a year
Secretary.
ago. So it seems that naaalala mo lang ako pag ECQ.
Ay, hindi. Always welcome kayo sa
Yes,
amin,
yes.
Sec. So, as you mentioned nga, Sec, we talked a year ago. A lot of things,
Yeah.
some things changed, some things didn't in that past year. And
Mm.
how about the tourism sector, Secretary? Where do we stand right now? Are we
Okay.
starting to recover or?
In terms of course, foreign tourist
Mhm.
arrivals, um, well, noong 2019, we had foreign tourists coming in, mga 8.26 million. But because of the pandemic, the
Mhm.
various lockdowns, nag-decrease siya. Mga January, may increase pa siya ng 9% in terms of foreign tourist arrivals. Then Feb, we started experiencing mga travel bans. And then March, travel restrictions not only all over the country but all over the world. So tourism decreased by about 82%. Yung, syempre, because of the foreigners. Last December, we already started to accept mga balikbayans.
Mhm.
But because of the UK variant, wala na naman. And then, so the whole January, walang balikbayans. Balikbayans are our third largest in terms of foreign tourists coming in. Number 3, US, sila balikbayans. Nung Feb, pinayagan na naman ang balikbayan. Pero again, because of the situation now,
Mhm.
wala na naman. So ang pwede na lang ulit yung mga, yung, of course, OFWs and
Mhm.
uh, returning Filipinos. Pwede.
Mhm.
Now, with regard to domestic tourism, pagka MGCQ na kasi, pwede na dapat ang tourism. That's according to the IATF. But we realize that a lot of our tourist destinations, kahit na MGCQ, ayaw pa rin ng LGU magbukas.
Mhm.
Nangangamba sila. So, a lot of people think na it's the IATF or the DOT that decides kung magbubukas ang tourist destination. Basta as long as MGCQ na sila, pwede na sila magbukas.
Mhm.
Ang ginagawa lang, ang mandate talaga ng DOT is to make sure that accredited yung mga hotels,
Mhm.
kung saan titira yung mga turista. Na especially now na it passes health and safety protocols.
Mhm.
Importante siya. Now, ginagawa rin namin, for example, ayaw magbukas ng LGU, may pangamba.
Mhm.
Like in the case of Baguio, we donated through the TPB yung kanilang online registration system para magka-contact tracing sila sa
Mhm.
Baguio, whoever tourists are coming in, at saka ma-regulate nila yung papasok. So that's what
Mhm.
we've been doing. We've been giving all the LGUs this free digital application para yung para magka-contact tracing, etc. Or in terms of it, ngayon kasi when we open tourist destination, of course, it's very important na number one, syempre accredited yung mga kung saan titira yung mga travelers,
Mhm.
turista. Number two, makikipagtulungan talaga sa LGU. Kasi
Mhm.
sila mag-i-implement. And okay na sana, marami na nagbukas like nagbukas na ang Baguio, Ilocos
Mhm.
Norte, Ilocos Sur, of course Pampanga, Boracay nagbukas
Boracay.
na.
Mhm.
Yun talaga
Palawan,
yun ang
Coron. Mhm.
Palawan, Coron, El Nido. And in fact, before all this happened, nag-agree na rin magbukas ang Puerto Princesa at saka San Vicente. Nag-agree lang sila nung March magbubukas.
Mhm.
Of course, bukas na rin ang Siargao. And also, nag-agree na rin sana magbukas ang Siquijor at Negros Oriental.
Mhm.
Dawin, kasi yun ang mga dive spots.
Mhm.
So marami na talaga nagbubukas and we were all looking forward sa Holy Week. Kasi Holy Week, doon talaga bumabawi And proud to say, since we reopened, I have to say na kasi when you reopen talaga, you really work closely with the LGU and the private sector. Tulong-tulungan kayo. And because siguro of tulong-tulungan ang national government, local government, at private sector, walang outbreak because of tourism. Kasi kailangan talaga yun na nga you have to really work together. Kasi kami naman sa DOT, mandate lang talaga namin are the accommodation, di ba? But yun. So yun na nga, proud to say. So we were really looking forward to yung by the way, yung mga protocols rin, akala ng lahat, DOT rin ang nagde-decide ng protocols. It's actually the LGU. Like yung test before travel, that's also the LGU. That's on them. Siyempre kasi we respect the LGU kasi sa kanila yun that's why we respect the LGU kasi kung magkaka-outbreak, that's on them, di ba? Silang mag-i-implement ng, let's say, localized lockdown, etc. So ang nagde-decide kung may test before travel or wala is the LGU. Kami naman sa Department of Tourism, like, ang dami na nangyari pala, no, since we talk to each other. Marami syempre sa mga travelers natin, namamahalan sila sa test before travel. Actually, before pa nga yan, that was up mga 11,000 per person. So the Department of Tourism, together with other government agencies, naghingi kami ng price cap kasi masyadong mahal. So, nababa sa 3,500. Pero it's still expensive considering, kunyari, example, family of 5. 3,500 times 5. Mahal pa rin siya. So, nakapag-tie up kami with the UPPGH and PCMC. Yung PCMC, naubusan lang yung pondo, but we still have with the UPPGH. Yung PCMC nga the test before travel, we were able to lower it as low as 750 pesos. And then results come out in a day. PGH, nandun pa rin, may pondo pa kami natitira doon. Nagiging 900 pesos na lamang. So, it's very important talaga that pabago-bago talaga you have to be, you have to know what's on the ground. Kung why are people traveling, why aren't people traveling. In fact, we've done 2 travel surveys since last year. We did one noong May and then another one last November. Interestingly enough, noong May, kaya we knew that we had to really focus on health and safety. 96% of the ones that were surveyed, the survey pala was done with the AIM, Asian Institute of Management. 96% said that they are willing to travel, but they wanted to see certified disinfecting protocols. So health and safety, yung number 1. Now, nung last November, very interesting. We asked, why do you want to travel? Ang sagot nila, they want to travel for their sanity. Yon. So that was very number 1 yon. The number 2, gusto naman daw nila mag-travel, pero ang dami-dami daw requirements ng tourist destination. So because of that, maraming requirements. Like ako mismo, kami sa Department of Tourism, usually pag government officials, we are normally exempted na from all the travel protocols. But kami sa DOT, we choose to follow all the travel protocols. Why? Because we want to see how it is for a normal traveler. Kung ano yung ini-experience niya. So, alam mo ba, before, negative na ako sa RT-PCR, but I still have to get a health certificate. I have to get some barangay clearance, PNP clearance, affidavit of undertaking. Ang daming dokumento before you can reach the tourist destination. So, at least the IATF 101 resolution, sinimplify yung requirements. Na wala na yung kung negative ka na naman sa RT-PCR, wala na yung medical certificate, yung marami ng documents as long as negative ka sa RT-PCR. So, interestingly enough, that came out in the survey nga. So, where are we now? Right now, we are ECQ, we were looking forward to Holy Week. In fact, I've talked to some of the stakeholders in Boracay. They were 90 to 100% full already. So dito nang babawi, people were already confident about traveling. As I always say naman is, dapat talaga you just follow the minimum health and safety protocols. Pero yun na nga, 2 weeks before Holy Week, binawalan because of all the cases and the new variant, binawalan yung travel outside NCR+. The clients usually come from NCR+, going to Boracay. So yun, nandun tayo ngayon.
Mm-hmm. You mentioned earlier, one of the points that I have here, sa mga nasabi nyo kanina, is you mentioned that it's not, the tourism sector is not the reason why we had this recent surge. So you mentioned that sector. But if you let's say I have here an article from April 1. It says Boracay Village under ECQ due to spike in COVID-19 cases.
Yes. It's the locals. It's not tourism.
When you read these articles, some people might
actually
think that,
it's because of tourism. In fact, when I syempre not only Boracay, but I look at all the cases, like for example in Baguio, pag tumataas ang cases nakikita ko, I always call up Mayor Magalong. And then he says, no, it's not because of tourism, it's because of other factors. This was not tourism, not related to tourism, but the locals that are there. So yun na nga, lagi naming sinasabi ngayon, although I commend the LGU na nag-surgical lockdown siya, kami naman kasi sa DOT, yung mandate namin, let's say may magka-positive sa isang hotel, following DTI DOLE, dapat mag-close siya ng 48 hours. So yun lang ang sinusundan namin. But we immediately talked to the LGU. Sabi namin na, first tinanong ko, is this because of tourism? Hindi, it's not because of tourism. And that's why I also said earlier, it's very important to work together with the LGU. Importante. In fact, the Department of Tourism, through the TPB, nagbigay kami ng 10 million pesos para ma-test for free ang lahat ng tourism workers. So that's also from the DOT TPB. So, kasi we're very careful kasi may test before travel, okay naman yung turista, but we also want to make sure that those working in the tourism those working in the hotels, or the tourism sector, yung kung makahalubilo naman nila yung mga sa hotel, yung mga driver, etc., dapat negative rin.
So you're saying, Secretary, that it's not the tourism sector, but it is other factors, including the locals in these LGUs. As confirmed.
That's this was confirmed by the Municipal
LGUs.
Health Office, yes, the LGU. So this was confirmed. Kasi syempre, it's a concern rin to me kung it's the tourism. Kasi right now, it's not naman, we have to check kasi, because if it's because of tourism, what can we do? What protocol should we adjust? Dapat ba instead of 72, 48 hours? So, I don't, you have to be proactive eh. I don't see this as against tourism eh. Kasi di ba, the whole world naman eh, we are all learning this at the same time. And for me, we want to restart tourism, health and safety as a priority, not only of the travelers, but of the people living in the destination, lalo na yung mga nagtatrabaho doon. Because hindi lang dapat safe yung travelers, pero everybody in the tourist destination at yung mga waiter, yung mga bellboy, yung mga driver, dapat lahat sila safe. We have to restart tourism. May balance yan eh. Restart the economy kasi masyadong marami nang nawala ng trabaho. But at the same time, with health and safety as a priority. In fact, even the protocols, the health and safety protocols of the accommodation establishments, yung hotels, yung tourist land transport, lahat, yun lahat ay not only world standards but dinaan namin sa Department of Health at sa WHO. Kasi we are talking now of COVID eh. So the protocols we have to get the go signal of the health experts.
Now, Sec, that brings me to my next question, which is, where does the Department of Tourism come in? Let's say when we hear stories about tourists faking their test results. When we talk about, because it's a two-way, dalawang you have the tourist side, then you hear stories about tourists faking, and on the hotel side and establishment side, now when you hear stories about resorts having these wellness programs to say that your travel to these establishments is essential. Where does DOT come in when we hear these stories?
As long as with regard to, of course, the hotel, like for example, the LGU, dapat may test before travel and dapat certified. Syempre, we always constantly remind the establishments, mga hotel, that they cannot accept first of all, kung walang hindi negative test before travel. At lagi naman paalala yun eh, even if you are negative sa RT-PCR swab, it does not mean pwede ka na mag-party or pwede ka yung pre-COVID activities. Dapat nag-iingat pa rin eh, yung face mask, face shield, physical distancing, washing of the hands. So lahat yun, nandoon yun sa mandate ng yung mga protocols ng Department of Tourism, which you cannot be accredited if you do not follow. And I am grateful naman that the hotels, the accredited hotels, they strictly follow this. In fact, I've had a lot of visitors and friends who have visited Boracay. Sabi nga nila yung mga hotel daw, walang pagod daw na pinapaalala sila, please wear your mask. Except, of course, when they're eating. Siyempre, hindi naman pwedeng nakamask. Diba? Always wear a mask when it makes sense. But I'm very grateful to all those accredited na Department of Tourism na sila mismo pinapaalala nila. And I think they understand that we have to work together kasi para tuloy-tuloy na ang pag-start ng tourism without compromising the health and safety of anybody. Now, with regard to yung mga nagfe-fake, of course, we have to work with the LGU. Tinatanong namin ano bang ginawa ninyo. But the latest of the Boracay, yung mga nagpeke, we found out that some of them pala kaya nila pineke because positive talaga sila. Gusto nila mag-Boracay. So, pineke nila. So, we filed cases against these people. Kasi, we are serious kasi. Alam mo, ang mandate talaga ng DOT is really just, yung mandate namin is the accreditation, etc. But, syempre, kailangan natin, we also have to brand that it is safe to travel around the country. So, sumobra na kasi and as I understand, the LGU also filed cases, but we also decided kami sa DOT, we also filed cases against these people kasi napaka-irresponsible talaga. Alam naman nilang positive sila kasi 'di ba when you talk about COVID, your responsibility is not only yourself but for others na alam naman nilang positive sila, pumunta pa rin sila. Tapos, kung paano nahawaan nila yung katabi nila sa eroplano or yung driver or yung boatman. What if sila yung nagka-COVID dahil sa kanilang kapabayaan? Diba kawawa naman? And what if wala silang pambayad? Yung COVID now is a responsibility not only for yourself, but you have to think of the community. And especially these tourist destinations, ngayon pa lang bumabangon. Tapos kapabayaan. So, when you are a responsible tourist, it's not only that yung, di ba, dati na yun pre-COVID, responsible tourism, dapat save our spots, you have to take care of the environment, etc. Kasama na ngayon, because of COVID, you have to make sure that kung talagang yun ang hinihingi ng destination, negative RT-PCR, sundan mo yon, huwag kang mameke. And let's say, nangyari, negative ka nga, pero at the day that you were traveling, inuubo ka, masama pakiramdam, lagi naming sinasabi, huwag ka nang tumuloy. Anyway, we are again grateful to the airlines and the hotels kasi meron na silang rebooking without penalty. So, para rin yung again the importance now is it's not only up to the DOT but you really have to work with the private sector and the LGU.
So so the DOT, I understand the DOT filed cases against these individuals faking itong mga results nila. So that's something I guess that's very commendable because we are implementing concrete actions to address these. But Secretary, the question now is, how do we really make sure na hindi na mauulit yung mga ganitong instances?
Well, we hope that, that's why we filed the case, hoping na hindi yung para makonsensya na lang siguro or at least makita ng mga tao that we are serious about alam naman natin lahat, di ba? I think wala pa akong nakikilala na nagsasabi, it's cool to fake your RT-PCR. It's not cool. Now, pag sinasabi nila, kasi masyadong mahal, tinugunan na namin yun, di ba? Sinubsidize na namin. Kaya naman talaga gawin eh. I guess it's really, ganun na lang siguro. That's why, like UPPGH, I also commend them dahil maraming gumagamit ng UPPGH na yung kunyari UPPGH tapos fake pala. Ngayon meron na silang watermark seal para to verify na talagang authenticated sila. Verified yung RT-PCR. Oo. Yes, so again, we really just, ang sinabi na namin sa LGU, kung may doubt kayo sa veracity ng RT-PCR, huwag niyong papasukin. Kasi sabi nila minsan daw sinisigawan daw sila, etc. Yung typical nagpa-power trip. Sabi namin, huwag kayo pumayag. Kasi pag nakapasok na yan, mas mahirap hanapin at baka naging super spreader pa.
Secretary, this is probably one of the things na marami ngayon ang nagtatanong sa Department of Tourism. How about international travel? Meron bang naiisip na ways ang Department of Tourism or is it really something na far from reach given the situation like this?
Well, everything is really it's collegial, the IATF. We are one of the members of the IATF, and of course it's collegial. We were hoping kasi na pinayagan na yung Balikbayan. That's as I've said, is the third largest market, and we were hoping na sunod-sunod na sana yan, diba, parang baby steps. But in certain cases, meron na mga film, those who want to film from abroad here. One movie outfit or TV outfit, they wanted to film in El Nido, Palawan. The other one, they wanted to film in Caramoan. Pinayagan naman sila. We called it a film bubble. Like nag-quarantine muna sila dito, and then pagka-quarantine, they were allowed to already go.
Last question na lang, Secretary. I think a perfect question to ask is, how do we balance health and opening the economy? Because there have been talks that the surge was the surge was caused by the reopening of the economy, and that includes the tourism sector. How do we make sure that there is a balance between the two?
I can make sure because you can ask any tourist destination. It was not because ang tourism naman papunta sa tourist destination eh. 'Di ba? It's not NCR. The talks are because of the variant. But kami naman in Department of Tourism, we always follow the health experts. We have all these ideas. And then, we kasi like what I said, even ang health and safety protocols namin, dumadaan yan sa health experts. Kasi hindi naman kami doktor and they would understand more COVID. Diba? And even yung ultimong, how many people can stay inside the room, dinaan namin yan sa health experts kasi hindi naman namin alam eh. Lahat yan dumadaan. Everything that we do sa Department of Tourism, whether the guidelines, or the reopening, etc., that is always guided by our doctors. We want to restart tourism, but syempre, we do not want to compromise health and safety. So, gano'n naman always kami guided. Syempre, I admit, it was, nag-stress eating ako talaga when I found out that, yun na nga we had a meeting on a Saturday night and we were told by the health experts that we had to stop non-essential. Pag non-essential na yan, kasama na ang tourism. It was tough, but then, yun na nga you have to listen to the health experts So, gano'n naman kami. We are always guided by the doctors. Diba? We follow them. So like yung earlier, kasi tinanong ko na maraming beses yan paano kung vaccinated? Baka naman pwedeng hindi na mag-quarantine. Sabi nila, hindi pa pwede. Ganon. So ngayon, I will bring this up with them. What if yung ganyan naman ako, but always, hindi ko naman ipipilit ang isang bagay. Pag sinabi talaga ng mga doktor, hindi talaga pwede. Hindi ko pipilitin. But kaya ako, I always also look at all the other countries kung ano yung ginagawa nila. Because sila nga their economy is highly dependent on tourism. Tayo nga our tourism sector is more on domestic tourism actually Dependent on domestic more than international. So sila, they really have more to gain if they open up. So I'm really closely watching on what they're doing. And I like what Phuket is doing. It's exactly what my thoughts were months ago about sa vaccination and the way to restart tourism. So we'll see. Again, people might think nga that we want to open tourism na walang science involved. We are always guided by the health experts.
Mm-hmm. Last na lang, Secretary, as we close this interview, any message to Filipinos who miss traveling, miss going around the Philippines? Any message to them?
The last survey that we did with the AIM was very telling because people want to travel for their sanity. I know that a lot were looking forward to Holy Week. They were either going up to Baguio, going to Boracay, El Nido, Coron, Siargao. Even staycation. A lot were already booked sa staycation. And, but yun na nga, because of what happened, we had to stop non-essential travel. Unlike last year, when the pandemic started March, and then we really didn't know how to go about this because there's really no handbook for COVID. I mean, we are together with all the other countries in the world. Right now, we know what to do. We know that we have to follow the minimum health and safety protocols, yung wearing of the mask, face shield, washing of the hands, sanitizing the hand, physical distancing. And meron ng vaccine. Di ba last year, pinag-uusapan pa yung vaccine, baka daw 3 to 4 years. Ngayon, may vaccine na. At least I've been seeing our health workers, senior citizen, comorbid, and in Manila, yung ating mga frontliners na nagtatrabaho sa quarantine hotels na vaccinate na. May light at the end of the tunnel. May solusyon. Yung hindi na yung hopeless na hindi mo alam kung anong mangyayari. Ako mismo, I'm waiting for my turn to be vaccinated. I'm actually A3. I'm comorbid, but I'm still waiting until more get vaccinated. But I want to be vaccinated also because like everybody else, I want to yung tuloy-tuloy na ang pag-resume ng tourism sector, resumption ng tourism, magkakatrabaho na lahat. And for everybody watching you, please, right now, those living in NCR+, please support local pa rin. You can buy online muna. Book. You can book. Marami naman ngayon may rebooking without penalty. But when travel restrictions are lifted, when the health experts tell us it is safe to do so, please travel locally, support local, and just have a safe trip, Pinas.
Thank you so much, Secretary. Again, that is Tourism Secretary Bernadette Romulo-Puyat. Thank you for joining us, Sec, ating suke dito sa Inquirer.
Sana hindi ECQ suke, pero pag MGCQ suke, pwede na.
Thank you so much, Sec. Again, my name is Neil Arin Mercado. This is the Inside Look. Thank you so much. Keep safe.